Nursing is perhaps California's most trusted profession, but should nurse practitioners or advanced degree nurses be allowed to practice without the supervision of physicians? Governor Newsom will have to decide within 5 days. Tonight, a look at both sides of Assembly Bill 890.
You just want the doctors to listen to you.
Following what she calls bad experiences with 2 MDs, Imelda Jaime of Santa Ana
¿Se siente mejor?
started seeing an NP.
The nurse practitioners tend to take a little bit more time with the patients.
If the governor approves AB 890, California's NPs would be able to provide basic primary care without physician oversight.
This just frees me up to be a little bit more creative in my approach to patients.
For years, there have been failed attempts at various versions of the measure. It's the first time on the governor's desk. Supporters say more independence for NPs would ease primary care shortages, especially in underserved and rural areas.
This bill actually does not mandate that they go to rural areas. It doesn't mandate that they go into primary care.
LA psychiatrist
How's your concentration been during the day?
and member of Physicians for Patient Protection, Dr. Laura Kendall believes it's a risky remedy.
When you don't know what you don't know, really bad things can happen. It requires many years of training to know all the possibilities that could happen.
22 states and D.C. already allow NPs to work independently. Similar legislation is also being considered in Texas, where Jeremy Wattenbarger's 7-year-old daughter Betty got sick on a Sunday.
She had rapid breathing. She's looking a little yellow. She's looking like she has a bluish tinge to her lips.
And died Thursday.
It's a nightmare that's just beyond belief.
Jeremy had taken Betty to an urgent care where an advanced practice nurse diagnosed Betty with the flu
And they kept reassuring us she's going to be okay.
and sent her home. She died in the morning.
If she would have went to a doctor inside of an emergency room or other skilled facility, they would have recognized that, hey, these are the symptoms of sepsis.
We could probably bring as many examples of physicians who did the wrong thing or, misdiagnosed.
In a statement, the California Medical Association says corporate hospitals are backing this bill as an end run against key patient protection measures that prohibit them from directly employing physicians. This has much more to do with corporate profits than it does access to care.
When there's no supervision required, they can then just replace physicians with nurse practitioners. And so people who are stuck in that system have no choice but to see a nurse practitioner who has lesser training. And those who can afford it can go outside of that system, and then therefore it's a two-tiered healthcare system.
Dr. Kendall says she's worked with great NPs in her career, but she would like to see the healthcare system remain a team model.
We're in a situation now where we need all hands on deck. We got to untie some hands so we can all take care of patients.
And here's how the training breaks down. After 4 years of med school, a family physician must complete 3 years of residency and more than 20,000 clinical hours. A nurse master's program can take up to 3 years, and a minimum of 520 clinical hours are required to graduate. Now, if the governor does sign AB 890, it will not be implemented until 2023. And even then, to practice independently, an NP must get national certification and have 3 years of experience working under a doctor.